So if somebody is wearing a loose-fitting denture, or you can't save all their teeth and they need a full mouth of extraction, but they don't want dentures, what's their options when it comes to dental implants in your office?
We get a lot of these patients that come in, and we're so excited to see them because we know that we can help them and really transform their lives.
Okay.
So one of the first options we present is a 2-implant snap-in denture. Okay. And what that does is that takes a patient that has a denture that's floppy, it flips around, their lip is kind of knocking it, their tongue's knocking it, and what that really does is that secures that and kind of keeps it down so it's not popping up or riding up. Okay. Now it's a wonderful option, but there are some limitations because it's still a denture, it's still resting on the gum tissue, so there's still food that can kind of creep underneath it, and they really don't have the biting force or the biting power to really eat all the foods that someone would want to eat with a healthy diet. So they're not really tearing off or biting into apples or tearing meats and things of that nature. So there's some challenges to it, but it's a wonderful option. And there's a lot of maintenance with those snap-in dentures because they're still made of acrylic, so they can crack and they can break, or you can chip a tooth and the connection pieces can wear down. So I'm not a huge fan of those options because of all the maintenance and follow-up work that these patients have to go through. But it is a great option when we're looking just to kind of secure a denture down and make it better than a denture. That's one of the best ways I can describe it. So the second option that we have is a 4-implant anchored in denture, but it still snaps in and it snaps out. And these patients really start to notice that there's a lot of security with that. There's a lot more stability. It's not rocking or moving as much. And these patients can be very happy with this option. There's still problems though because it still does come in and out. So the parts and pieces can wear down, the acrylic denture can chip or break. But a much better option than the 2-implant, but there's still some challenges with that. And I spend a lot of time educating patients on the challenges that 4-implant snap-in denture can present. Now the next option really is a separator. And I really kind of to draw a divide because this option allows them to have a permanent fixated set of teeth. So we get away from the bulkiness of a denture, the sore spots of a denture, the food getting up underneath it, the little rice pieces and nuts and things getting underneath it. And what this really does is this takes a patient who really was having a hard time eating, a hard time chewing, not getting the full range of foods that they need for a healthy diet. And it really brings all of that back into their lives. Where they're
these are teeth that don't come in and out?
Correct. These teeth.
And they can eat whatever?
They really can eat whatever they want without any limitations.
Can they bite like a carrot? Like if you're doing upper and lower fixed teeth that don't come out, they could bite things with their front teeth? Or they still have to be careful?
Well, anything that you could eat with your natural teeth, you can eat with these permanent implant supported teeth. So they're tearing into a juicy steak, they're biting off on an apple, they're eating carrots and nuts, and really this full range of food that's part of a healthy diet. And in our practice, we really focus on full health wellness. So part of this education process is to say, listen, these foods are needed to sustain this long, healthy lifestyle that we all want. And they lose track of the type of diet that they had through their denture process, where they're really eating these softer, high processed foods, and now we're bringing in the more
like vegetables,
correct,
and maybe some lean protein.
Yeah, and that's the wonderful thing that really we see our patients coming back because they're coming back with a healthier look, they've lost weight, they have more energy, and it's just such a great service that we offer.
How old can you be to do this?
You know, it's something that there's really not an age restriction.
Like 80? You can do this, 90?
We have 80-year-old patients all the time because, and we are living longer. So we have patients that are living to 100, 105 years old. And so an 80-year-old, you have 25 years left.
So the implants go in and they're not statistically more likely to fall out if you're 85 or 90?
No, we have, there's no statistic. If you're a healthy person, you're a healthy person. And what we're able to do is we're able to of course, identify all these risk factors, but it's such a predictable procedure. And with our technology and the skill set that we have, we make it predictable for all our patients, regardless of age.
Can you have a little bit of osteoporosis or type 2 diabetes that's controlled and do this?
Yeah, and that's part of our process where we really review the medical history. But yes, you can have some underlying medical conditions, but just like with anything, we're going to work with your physicians to make sure that everything's controlled and make sure that you're in a good state to handle these type of procedures. But absolutely, it can be predictable for someone of any age. And we don't like to try to talk that, oh, there's this age limit, because people, they're vibrant into their 80s and 90s.
So no more
years old.
dentures?
No more dentures. And
Like nobody should be wearing a traditional denture? Do you feel that way?
to me, I think if I could send up one statement that everyone takes is there's no reason to live a life that's restricted by a floppy, movable, unaesthetic denture. We can put you into something fixed and it'll change your life
But the
dramatically.
upper denture, isn't it because of the suction fine? Like an upper denture?
It's interesting because a lot of times we'll hear that. We'll hear a patient say, well, my upper denture's fine. I'm not really too worried about it. But what's happened is they've settled for this feeling of having this big, bulky coverage over the roof of their mouth. So they're not tasting the foods that you and I would be tasting. And they're not speaking with the proper pronunciation like you and I are. And they've just adapted to this lower level of a lifestyle. And what we want to educate is we can change that. We can give you back that feeling and that taste and all of those things that have been missing for many years.
So full set. Now you said on the upper, like 6 implants, give them a full arch of teeth.
Yeah.
Is that right? That don't come in and out?
Absolutely. With only 6 implants, we can give you a strong base to hold a full arch of teeth, and we can do that in one day. So it's a transformation that can happen very quickly, very efficiently, and it's life-changing. These patients are coming in 2-3 days later after their procedure saying, hey doc, I did not know this was possible. I did not know that I could have such a life-changing event in one visit.
What about pain? It seems very painful.
Yeah, it does seem very painful, but pain is not something that we hear our patients complain about a lot. Usually, they're very excited about the procedure. They come in. Many people have very little memory of the procedure, and they wake up and the procedure's done. They go home. They take a nap. They rest. They recover, and they're feeling good after a few days, and they're just so excited about the transformation that they went through.